Hi, my name is Feroz Agad. I'm chairman of SAH Global. We've been presenting at Untapped Health for the past 8 years, and we are proud to say that we're presenting this year also, which is its 40th anniversary. And Untapped Health has been a great platform for us to present the products that we are actually selling. Not only do we sell equipment, but also we have 4 divisions within SAH Global. Under SAH Global, we've got a separate subsidiary called SAH Care, which is currently providing treatment abroad for patients that require treatment of cancer. SAH Global focuses on proton therapy, which is the next generation of cancer treatment. So we are providing treatment abroad for patients that qualify with proton therapy. We are working with the Ministries of Health. We have agreements with, for example, like the Bahraini Ministry of Health, where we're taking patients to the US for treatment. We provide a complete end-to-end service, whether it's looking at the scans, giving reports, medical reports, providing secondary opinions, as well as not just helping the patient with the visa processing, providing transportation to and from the center, and of course the treatment of the patient to be successful. The second division within SAH Global is training and education. We feel that one of the core factors in terms of bringing proton therapy to the region is to train and educate the physicians that are going to be operating the facilities in the future. So what we are providing is not only training and education at our facility located in the US, at our partner facility in the US, but also providing training workshops where our physicians and our partners, which are our physicians, are our shareholders, they come to the region and they will provide on-hands training with workshops with physicians, with neurosurgeons, with oncologists, medical oncologists, radiation oncologists, therapists, etc. That leads to the understanding of what is proton therapy, and we believe that that is the bridge that will bring more understanding of this cutting-edge cancer technology. The third division that SAH Global has is equipment distribution. We have partnered with a company called IBA, a major equipment manufacturer in the field of proton therapy, that manufactures the equipment. Within that, we have a fourth division where we not only supply the equipment, but we also design the facilities, we develop the facilities, and we operate the facilities. We are currently operating with our team of physicians the largest proton therapy center in the world, located in Hampton, Virginia. And also, in addition to with our physicians that are operating this facility, in addition to, we are also providing on-hand training and education. You are looking at a model of a proton therapy system. The cyclotron, which generates the actual protons, where the splitting of the atom takes place, we will take a hydrogen atom and we will split it. The electrons will be separated from the protons. The protons are then cycled at 235 million electron volts, which equals the 2/3 the speed of light. The proton will then go into the beam transport system, going directly into what is known as a gantry. The gantry is the actual treatment room in which the patient lays in. The treatment room in this particular instance revolves 220 degrees. There are other treatment rooms that revolve at 360 degrees around the patient. The patient lies inside of the treatment room, and you can see that you have a robotic arm, and the reason why the robotic arm is there is because of patient positioning. This ensures that the patient will be in the correct position every time the patient is treated. This is very important when it comes to proton therapy, and the reason why that is important is because with proton therapy, it is precise treatment of the target area, which is the tumor. When you compare it to conventional radiation therapy, proton therapy treats on average 70% less healthy tissue compared to conventional radiation therapy. What that means is less side effects, less costs in terms of malnutrition, radiation poisoning. It also means that we have greater success rates with proton therapy. And what you will see is when the patient lies inside of the actual gantry, the gantry will rotate around the patient rather than having to position the patient around the actual beam, which makes it very comfortable for the patient and very safe for the patient. Now what you will see is the control room. So the physicians and the radiation therapists will position the actual patient, and then they will come out into the control room where they will allow for the beam delivery to take place. Once this has taken place, again, the therapist will go inside, bring the patient back outside of the actual facility. Now, in this mock-up model, you cannot see the intricacies of how difficult it is to build a proton therapy center, and this is an expertise that our team has developed, bringing a combined experience of 125 years in the field of proton therapy. Each of these shielding walls, you're talking about roughly about 6.5 meters thick of concrete shielding walls. These concrete shielding walls obviously protect any individuals around from being contaminated with protons or any kind of other byproducts. So we are often asked that, well, with SAH Global, it seems like you do everything. In essence, we do try to provide a complete turnkey solution, whether it's consultation services, if someone needs consulting on how to design the facility, what equipment to select, how to work through the patient flow through. We are advising customers on this. In addition to this, we also provide design services, on how to best design the facility to make it the most optimal, and then obviously training and education. But we also at SAH Global own our own proton therapy center. We are establishing proton therapy centers in the MENA region. We are looking at Europe as well. We've been approached to do a couple of centers in Europe. In addition to this, within the same division, we are also partnering with other facilities that want to build proton therapy centers to provide a complete turnkey solution, which includes the operations of facilities. So if you have anyone that knows anyone that's suffering with cancer and needs treatment today, please go to our website at www.sahcare.com. And if you know anyone that would like to participate in a proton therapy center or would like to partner with us in a proton therapy center, I would ask that you go to www.sahglobal.com. I would like to also thank Exhibitors TV. If it's not for channels like them that are online, social media type of facilities that are provided, then the word does not get out. And for people to get to know what proton therapy is, I believe it is essential for us to communicate through these modes and through these online channels. So I would like to thank Exhibitor TV for giving us this opportunity to present what we are doing. And also I would like to say that UTOB Health has been an excellent platform for us. We've signed major agreements with General Electric and also IBA, and other major agreements that we have signed have come through the platform of Arab Health, and I would like to thank the organizers of Arab Health and also the individuals that run Exhibitor TV. Thank you very much.